Hello everyone, Happy New Year to all of you as this is New Year Eve. So first of all, wish you very Happy New Year to all of you. And now today I will discuss about stroke, causes of stroke, as this is the uh, third part of this stroke series. And today I will discuss about the important causes of stroke. Stroke, most common cause of stroke is large artery atherothrombotic event. Actually, what happens when you smoke or even if you have diabetes, hypertension, high cholesterol, it damage endothelium, and this damaged endothelium lead to the formation of plaque, atherosclerotic or plaque or atheromas formation. These atheromas have inner soft gelatinous portion and outer fibrous cap, and when this fibrous cap get ruptured or there is a plaque rupture, then this inner gelatinous substance come in contact of blood and there's formation of a thrombus, and this thrombus lead to blockage of blood flow and patient develops symptoms of stroke. So most common cause of this plaque formation is branching of blood vessels. Most common site is CCA, bifurcation, but it may occur in intracranial blood vessels also. Now, after this, other causes small vessels or penetrating artery disease that lead to lacunar stroke, and the important cause are risk factor are diabetes, hypertension, and smoking again here. Okay, and this lead to formation of lacunae, which is 0.5 mm to 1.5 centimeter in size, and patient present with pure motor or pure sensory or sensory motor or ataxic hemiparesis or clumsy hand dysarthria syndrome, as I discussed earlier also. Now, third cause is cardioembolic. Cardioembolic stroke account for 15 to 20% of all ischemic CV. And among all the causes of cardioembolic, most common is AF, arrhythmias, AF. And this AF account for 1/2 to 2/3 of the patient of cardioembolic stroke. And this AF, you should remember one more point, that some brain lesions are also arrhythmogenic. Some brain lesions are also arrhythmogenic, especially insular infarct. In fact, at parieto-insular region or brainstem infarct, they also produce arrhythmias. So never confused with, never take so much easily if you see a infarct at parieto-insular area and you get AF in that patient and you think that AF is a cause. Infarct also may be a cause of this AF or arrhythmias. Okay. Then other causes such as acute MI. Suppose patient is having MI and then subsequently he develops stroke, and the most of the stroke develop within 3 months, and out of which 85% develop within first month or 4 weeks. Then other causes are DCMP in children, congenital heart disease, prosthetic heart valve. Along with all this, a patient who undergo cardiac catheterization or CABG operation, coronary artery bypass grafting. So in these patients also, up to 5% patient may develop a stroke, especially in second post-operative day. So patient underwent CABG operation today and he developed a stroke tomorrow. So this is also a complication of CABG operation. Then after this cardioembolic, other causes non-atherosclerotic vasculopathy. In this non-atherosclerotic vasculopathy, dissection of aorta is important cause. This non-atherosclerotic vasculopathy account for around 5% of all ischemic CV. And dissection of aorta, there is a intimal penetration of blood and then longitudinal intramural extension above, and it presented as stroke. So either ICA dissection is most commonly in extracranial ICA or cervical ICA dissection are most common. Intercranial dissection may be there, but as external elastic lamina is absent in intracranial blood vessels, so it may present as SH also. And then after dissection of aorta, Moya-Moya disease is an important but rare causes of this vasculopathy in children. And here patient have stenosis of ICA, especially at supraclinite portion, and appearance of blood vessels, formation of blood vessels at the base of brain. Here Suzuki 6 grading also done, in which stage 1 there is a stenosis of ICA or carotid fogs stenosis, and then formation of blood vessels, and then development of blood vessels at the base of brain, then intensification, and then minimization of that blood vessel, then reduction, and then disappearance of that blood vessels. So there is also another entity that is known as Moya-Moya syndrome. It is Moya-Moya disease is of unknown cause, but Moya-Moya syndrome is because of TBM or birth anoxia. Okay, and children may present as a stroke, ischemic stroke, and adult as a hemorrhagic features. Then radiation vasculopathy or trauma at the angle of mandible may lead to the IC thrombus. Radiation vasculopathy, especially at hyperlipidemia condition, may lead to accelerated atherosclerosis and formation of thrombus. Okay, then other causes might include fibromuscular dysplasia, which has association with Marfan and Ehlers-Danlos, hyperhomocystinemia, and this may be seen in middle-aged female, and the most common site is cervical portion, C1, between C1 and C2. Stenosis might be there, and may lead to infarct later on. And in angiography you might see sting of bead appearance. Okay, so after this, there is an important cause of non-atherosclerotic vasculopathy, that is vasculitis. Inflammatory vasculopathy may be because of infection or non-infective inflammatory vasculopathy, and patient present with stroke and symptoms of encephalopathy. Now, infective vasculopathy may be because of TBM, tubercular meningitis, that commonly involve cranial nerve 3 and 6, and there is basilar arteriolitis of AC and MCA branches that lead to vasculitic infarct. Then some drugs, especially cocaine, may lead to infarct, and TAG or this illicit drug powder may get injected and lead to embolism. Okay, then migraine is important cause, rare but important cause of stroke in females, and especially if associated with aura. So migraine with aura is also again an important cause of this stroke. And if a female patient with this classical migraine take OCP or smoke, they have more chance of this. And then after this migraine, this non-atherosclerotic vasculopathy get ended, and then now after this the other causes like inherited causes. It may be hyperhomocystinuria. Hyperhomocysteine level in the blood may lead to accelerated atherosclerosis and formation of clot formation. And then idiopathic reversible vasoconstriction syndrome is also an important cause of dilatation of intracerebral blood vessels, and present as recurrent episodic headache and sensory and motor symptoms. Then CAA, CAA, cerebral amyloid angiopathy. It is again an important cause of ischemic or lobar hemorrhage. Okay. Then some miscellaneous causes might be there in a form of air embolism as a complication of surgical procedure, or fat embolism as a complication of long bone fracture, or amniotic fluid embolism, or especially in scuba diving, nitrogen embolus might get lodged in the brain blood vessels and lead to the encephalopathic presentation. Okay, so then hypercoagulable disorder. Hypercoagulable disorder, actually primary hypercoagulable disorder, commonly associated with venous infarct, especially antithrombin deficiency, protein C deficiency, protein S deficiency, and activated protein C resistance, APC resistance, or PT prothrombin G2021O mutation. So these are the primary hypercoagulable disorder that lead to the infarct, along with this APLA syndrome, antiphospholipid antibody syndrome, that lead to the venous infarct and recurrent fetal loss in female. And then dysfibrinogenemia or hyperfibrinogen, high fibrinogen level may lead to the infarct. Then after this, secondary hypercoagulable disorder like mucinous adenocarcinoma of GIT and lung. This mucin get blocked the blood vessels and lead to the stroke. And then pregnancy is again a hypercoagulable state. It lead to thrombus in the arterial thrombus, while puerperam period lead to the venous infarct. Then OCP lead to intimal hyperplasia and lead to hypertension, and it is again also lead to hypercoagulable state, so infarct might be there. Especially if a woman who smoke shouldn't take OCPs or should avoid OCP intake, otherwise the risk of a stroke may be much higher. And then ovarian hyperstimulation syndrome, due to clomiphene, it is again a hypercoagulable disorder, a state, lead to the thrombosis. And then anabolic steroid as used by athletes, or recombinant erythropoietin used as blood doping by them, or also used in CKD patient, may lead to the thrombus formation. Then polycythemia vera, PNH, essential thrombocytosis, these are also a cause. One important cause is high plasma homocysteine level. High plasma homocysteine level lead to the accelerated atherosclerosis and clot formation. Then sickle cell disease lead to moya type of syndrome, or watershed zone infarction between AC and MC. And then this TTP, thrombotic thrombocytopenic purpura, that lead to hyaline microthrombi and lead to clot formation. Now stroke may sometime, even with extensive workup, you didn't find cause, you've not been able to find the cause of this stroke. So a stroke of undetermined causes might be there, but in all patients who you are not been able to find the cause, patients who undergo Holter's or loop recorder to look for arrhythmia, as most of the cases arrhythmia might be a cause of stroke in such patient. So this is all about the causes. Now investigations. Among investigations, MRI is preferred over CT. MRI, good visualization of infarct size you might see. And MRI is also valuable if you don't know the time of ictus, because if patient sleep at the night and morning when he wake up, he find that he's not been able to move his hand or his leg. So at which time in the night he developed infarct, if patient underwent this MRI and DWI shows is positive, it shows infarct, and flare is negative, it means patient is still in window. Patient can be is a candidate for thrombolysis, and you can thrombolize that patient. Then angiography, especially non-atherosclerotic vasculopathy, differentiate between atherosclerotic vasculopathy and non-atherosclerotic vasculopathy. So angiography is also an important investigation. Some perfusion studies also done, and cholesterol level, TSH, CRP, homocysteine, CBC, KFT, LFT. So these are other investigations which should be done in general to all the patient, along with 2D echo, Holter's monitoring to find out cardioembolic stroke. Okay, so this is all about today's topic, and next time I will discuss about the prevention and treatment of stroke. Okay, again, happy new year to all of you.